One of the issues on the table with the shutdown are the expiration of the enhanced premium tax credits for marketplace insurance, and estimates are showing that Mississippi will be one of the hardest hit states, and hundreds of thousands of people will go without insurance next year. Was that a consideration in the rural health plan? And do you have concerns about how that will impact both people in Mississippi and hospitals?
Yeah, while the National Democrat Party has attempted to tie these two issues together, they of course have nothing to do with one another. The shutdown has absolutely nothing to do with the subsidies of the Affordable Care Act expiring. In fact, the subsidies in the Affordable Care Act are expiring because in a bill that passed the Congress 2 years ago with 100% Democrat support, the subsidies were added for the pandemic. They were added for a short period of time, and they were to expire at the end of this year because that's when the Democrats wanted them to expire. And so that's where we find ourselves today. Now, the subsidies, because they are based upon income, and because prior to the last couple of 3 years where we've seen per capita incomes in Mississippi rise faster than virtually any other state, we have a large number of people that are under the, and again, these ACA subsidies go up to 400% of the poverty level, I believe. We have a lot of people underneath 400% of the poverty level. We do have a fairly large percentage of our population, something less than 10, but something more than 6 or 7 that are utilizing these subsidies. And so what I would expect to happen is once this Democrat election in New York City is over tomorrow, that the Democrats will hopefully vote to reopen the government, and then there will be serious conversation and discussion as to what those subsidies look like going forward. I don't know that they're going to look if there's a vote. I think there will be a vote in Congress between now and the end of the year to extend those subsidies at some level. I don't know that it's going to be at exactly the pandemic levels that were put in place a couple of years ago, but I do think that there's probably going to be some support towards that end. That certainly seems to be the case from what I am hearing in Washington, but we'll just have to see.